Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Well, welcome, Blair. Thank you for joining us today, and I am turning the floor over to you.
Thank you, Lauren. I'm going to go ahead and share my screen here and pull up the presentation. Okay. So thank you so much, everybody, for being here today. I'm excited to be here with all of you. As Lauren mentioned, I am the Oncology Nutrition Coordinator for Northside and the Northside Hospital Cancer Institute, and also work very closely with the Cancer Support Community Atlanta. I have going on 20 dietitians. We're about to make our 20th hire underneath me, and we in turn cover 57 clinics in the state of Georgia. So we are busy, active. We love working with all of you guys. And I will preface this by saying this is a very general presentation. And if you are either in active treatment or in survivorship within the Northside Hospital Cancer Institute, we have a dietitian for you. So I will provide my email, the outpatient nutrition email at the conclusion of this presentation. We would be happy to triage you to the correct dietitian if you do want a one-on-one appointment. Just because everybody has different goals, medical history, side effects, symptoms, all those types of things. And so we want to make sure that you get treatment and dietitian recommendations specific to what you're going through. So today we're going to be discussing managing side effects with nutrition. This is before, during, and after treatment. A lot of what we're going to discuss today is primarily going to be during treatment. But if you are in survivorship and maybe have some lingering side effects, this definitely applies to you as well. So with that, I'm going to go ahead and get started. So today's goals for you is I'm going to be reviewing nutrition interventions and tips for before, during, and after treatment. And then we're also going to discuss some food safety guidelines. So before treatment starts, we want to hit the ground running and make sure that we're managing any problems that may make eating difficult. Our goal for you when you start treatment is to prevent any unintended weight loss, any loss of that muscle mass. And we also want to help your body keep the strength it needs to respond to treatment. And this isn't on this slide, but what I see most often when I talk to patients prior to starting treatment is they may be experiencing some anxiety, which causes difficulty eating. And so I help manage that aspect and that side effect that can impact nutrition. So our goal for you while you're on treatment is not to lose weight. Okay, so I'll have patients that may be technically overweight or obese say, "Oh, this is great. I'm dropping weight. I don't have an appetite. I have nauseated, so I'm losing weight." And the thing is, now is not the time to diet. Okay, so we don't want any of you losing more than 1 to 2 pounds a week max during treatment. Generally speaking, when you're losing weight rapidly during treatment, you're losing that good solid muscle mass, which we want to prevent, as I said earlier. And if you lose 10% of your weight on treatment, we have to reduce your chemo if you're on chemo. And then it also increases interruptions in treatment and things like that. So I really want to drive that point home. And then it also prevents hospital stays as well. So nutrition after treatment, my team wants to continue to manage any side effects that you're still experiencing, any weight changes. If, sometimes breast cancer patients might experience an increase in weight. Most other cancers, for the most part, are going to experience a decrease in weight. And so just getting that weight back up, rebuilding muscle mass, we work with that. Also preventing other chronic health conditions like heart disease, diabetes, osteoporosis, that some of the treatments and steroids may have increased blood sugars, and so we kind of help regulate that. And then some also impact bone health, and so it may be talking to you about calcium and vitamin D and rich foods and potentially supplementation and things of that nature. So common side effects of cancer treatment, of course, appetite changes. Most of the time, that's going to be loss of appetite, not so much increase of appetite. Nausea, vomiting, changes in bowel habits, so maybe some constipation or diarrhea. Fatigue. Fatigue is actually the number one side effect that I see both during and after treatment, as well as issues with the mouth, so maybe some dry mouth. Some of the chemo treatments can cause mouth sores, radiation as well, thick saliva or copious secretions, difficulty swallowing, taste changes, weight loss, and if you're on a treatment called oxaliplatin, that can cause cold sensitivity. So that's why that side effect is on there. So, what are some interventions to manage these side effects? So this says for decreased appetite and early satiety, and I'm also going to say that this is pretty appropriate for fatigue as well. I don't think I dedicated a slide to strictly to fatigue. Um, but a lot of times during treatment, you're not going to have those hunger cues that say, "Hey, April or Elizabeth, it's time for you to you need to eat now because you're feeling hungry." It's more so eating by the clock or eating because it's time. Okay. So if these are some of the side effects that you're experiencing, I would recommend either creating a meal schedule or setting some alarms on your phone to just say, okay, it's time to eat. It's 10 o'clock. It's been 2 to 3 hours. Let's get in a good source of protein and some healthy fat and a complex carbohydrate. Keeping your pantry and freezer well stocked with foods is really important. And that's so important for fatigue. And so if you're having a day where you're just filled with energy and you're just feeling good, definitely capitalize on that by batch cooking. And then you can break that down into smaller portions. You can throw some meals in the freezer. And then when you're having those days where you're feeling a little bit crummy or just a little low on energy, all you have to do is just throw those in the microwave and you are good to go. And then also don't hesitate to reach out for help. And so if you have family and friends that like to cook or that are saying, "Hey, how can we help you throughout this process?" Say, "Can would you mind cooking for me some, chili, soup, things like that that can be cooked and prepared ahead of time." And then also just having some non-perishable items ready in your pantry, that can be a good thing to do too. So that 6 eating episode a day, try to have that at bedtime, and that's good because it's not gonna affect your hunger for breakfast time because you'll have hours to digest. With this tip, I will say if you have GERD or reflux, try to wait at least 30 minutes to lay down and go to sleep after that last eating episode of the day. So after that evening snack, because we don't want to exacerbate your reflux. Your dietitian can really help you with this next tip, and it's making every bite count by choosing higher calorie foods. So I tell my patients you want to get a lot of bang for your buck. So eating things like cheese has a lot of calories in a small quantity, avocado, nut butters, trail mix, nuts. You don't have to memorize that or write that down. Your dietitian will tell you. But just things like that that are very energy dense and protein rich, but only take up a small amount of space in your stomach. That's a really good thing to do to get inadequate calories. And then sometimes if patients are having just swallowing difficulties, or I went through a health concern last year, just for full disclosure, where all I could do was drink liquids, so I get it. And so capitalizing on energy dense, protein rich liquids. Okay, so that's going to be things like your Ensure Complete, Boost Plus, things like that, and then also high calorie shakes and smoothies. So you can absolutely drink your calories and get in enough protein and energy. So that's just another option. And then we want to make sure that you're filling your stomach with actual calories. And so if you're drinking, say, water or sparkling water with your meals, try to just take small sips and try your best to hydrate in between meals. And so some patients even have to make a hydration schedule. So, just not filling your stomach with fluids when it could be filled with food is a good thing to do. So I'd say next to loss of appetite and fatigue, the second most or third most common side effect I deal with my patients is nausea and vomiting. And I'm going to preface this slide by saying my patients that are more adequately nourished and hydrated have the least amount of nausea, okay, and the least amount of side effects in general. So it is very important. So the eating 5 to 6 small meals a day instead of just having your typical breakfast, lunch, and dinner is good to keep nausea at bay. One trick of the trade is you never want to be too hungry or too full. So I'll have my patients just keep some saltines at bedside, and even before their feet hit the floor in the morning, to just eat 1 to 2 saltines just to get a little something on their stomach. And then you also don't want to be too dehydrated. So if you are having nausea and vomiting, you want to make sure that you're adequately hydrated and even replacing some of those electrolytes. So I've been recommending BioLite a whole lot. I have like a warehouse full in my office right now. I have about 10 boxes. But if you like Pedialyte, you can do Pedialyte, Gatorade, things like that. But you really want to try to get in about 8 ounces of rehydration fluid after each bout of vomiting and then diarrhea as well. So anytime that we lose fluids, we want to make sure to replete those fluids. So just sipping on that. Keeping your mouth really fresh by rinsing it with the teaspoon of baking soda, teaspoon of salt, and about 32 ounces of warm water, and just rinsing your mouth, swishing and swallowing, and switching and spitting that out throughout the day can help keep your mouth really clean. Eating bland foods instead of foods that are really fatty, greasy, spicy, sweet, and I'm going to add smelly because that can cause a little bit of nausea. So, when if you've had the flu in the past, you kind of know what sounds good to you and what doesn't. Just from experience, there's no science behind this other than some of the bland foods, but my patients generally tolerate cool foods better. Cheese and crackers usually works pretty well to get some calories in, and it's not real smelly. Um, Peanut butter crackers, peanut butter sandwiches, just things that are not hot and that are a little bit bland are generally pretty well tolerated. Also, cheese toast or toast with butter or toast with avocado is generally pretty well tolerated. Dry cereal, breadsticks, like it says on here. And then don't try to cook when you're nauseated. I don't know that I need to tell anybody that, but if you have somebody that can prepare dinner, if you have a family, and then you can just stay away from those odors, or if you have a spouse or a friend or somebody that can, throw something on the grill instead, just so those odors aren't getting in your house. That can help with nausea. Also, it's not on here, but ginger teas or little ginger candies. There's some called gin-gins. There's tummy drops. There's another one that you can order online that a lot of patients find helpful. And then I know I keep saying that that's the last thing I'm going to say, but I do have one more thing to say about this. Um, C-bands, it's a little bracelet that you put on your wrist, can be helpful with nausea and vomiting. And do not underutilize your anti-nausea medication. Okay, so there are tons out there, and if you're on one, like say on Danzatron's a popular one, and you're taking that every 8 hours as prescribed, and you still have some breakthrough nausea, I have patients on 3 anti-nausea medications plus using C-bands plus taking ginger. Okay, so you may need either a different anti-nausea medication, or you just may need one added onto your current regimen. So constipation, this one's more specific to certain cancer sites. I deal with a lot of ovarian and endometrial cancer patients, so I do see a lot of constipation, as well as some of the treatments cause constipation, even though more of them cause diarrhea. You want to eat at about the same time each day just to keep your body regular. Drinking lots and lots of fluids because dehydration can lead to constipation. And then just strictly warming up juice. So if you're not a prune juice fan, if you prefer apple juice warmed up, if you don't like the taste of prunes, that can help stimulate bowels as well as hot cereal. So anything hot can help with constipation. Eating foods high in fiber, so you can work with your dietitian to increase your insoluble fiber to help. Um, I will tell you that if you're going to increase your fiber intake, make sure to increase your fluid intake because that can lead to abdominal pain if you don't. So on the other side, diarrhea, I do have some patients that toggle between constipation and diarrhea. So these are just good tips to keep on hand just in case. Avoiding high fat, spicy foods can exacerbate diarrhea, as well as caffeine, fake sugars, anything with ITOL at the end. So sorbitol is an example here on this slide. ITOL at the end, that's going to be your fake sugars, artificial sweeteners, can cause diarrhea. Also, foods with a lot of sugar, and like I mentioned before, with the nausea and vomiting, you just want to make sure to sip on broth and sports drinks and fluids that are going to replenish those electrolytes too. Oh, okay, I said I didn't have a slide dedicated to fatigue. I absolutely did. Let me see if there's anything on here that I did not mention. Okay, one other tip that is good for both fatigue and constipation is to move. All right. And so movement's going to look different for all of you. I have patients that still run marathons, and so their movement's going to look a lot different than somebody that's in a wheelchair that can potentially just move their upper body. So a lot of patients ask to work with physical therapists, occupational therapists, or dietitians will refer them to those disciplines that can help with that. But from experience, the hardest part is getting started. So do what you can. If you're still moving around, try your best not to stop. Even if it's just walking to the mailbox every day, or breaking it up into walking 5 minutes 3 times a day and then trying to build up from there. But you've probably heard the saying, a body in motion stays in motion. And there's a lot of truth to that. So dry mouth, of course, you want to avoid dry food. So things like toast and crackers are going to be pretty hard to tolerate. So choosing softer, more moist foods. If you can use any type of gravy or sauce, that's going to be helpful. Soups are good for that. Sour, hard candies, anything to kind of stimulate the saliva is helpful. Sipping on fluids and liquids throughout the day can help keep your mouth from being too dry. We recommend a lot of times Biotin, that's going to be in CVS, Publix, Walmart, as well as I've had a lot of patients use something called Lubricity, and you can order that online. That's going to help with dry mouth. You can order that from Amazon. I think it's around $7 or $8 at Walmart too. So that's another really good product. And just continuing to provide oral care throughout the day. And also not using mouth washes with alcohol because that can dry out your mouth even more. So some chemotherapy treatments can cause mouth sores. So if you already have mouth sores, just making sure not to be drinking like acidic juices or eating things like oranges or acidic foods and other types of beverages. Choosing foods that are higher in moisture as well, avoiding hard or dry crackers, raw vegetables, drinking from a straw, trying ice chips to help numb and soothe the mouth, and providing oral care throughout the day. So a lot of physicians will prescribe something called magic mouthwash that can be helpful, so making sure to use that. Um, and then just talk to your dietitian about different products that can be helpful too, and just to keep those mouth sores at bay. And I mentioned earlier the solution with a teaspoon of baking soda, a teaspoon of salt, and 32 ounces of water. And that is actually a really good solution to stave off mouth sores. And so I'd recommend swishing and spitting out the baking soda salt solution 3 times a day. With that, you're going to make a fresh batch every single day. So don't put it away for the following day. We want to make sure it's fresh. And that can just cause your mouth to be really clean and can potentially even prevent mouth sores. So that's another trick of the trade that isn't on that slide. Also, don't eat foods that are too hot or too cold. That can be offensive to mouth sores. So I mentioned thick saliva or copious secretions. That oral care rinse is here as well. Cafazole is something that some of the patients use up to 10 times a day, and that's just mouth rinse. Elevation of your head while in bed up to 30 degrees, even more, I'd say even like 45 degrees. Using a vaporizer in your room can be helpful. And then some physicians will prescribe lorazepam, as well as a portable suction machine to help with these thick saliva and copious secretions. And we see this a lot in our head and neck patients. Here's some more ideas. Increasing fluid intake, mucinex, glutamine, some of the fruit juices with pineapple and kiwi, papaya, that can help break down saliva. Magic mouthwash is useful in this case too, as well as honey dissolved in warm water. So difficulty swallowing, we see this in our head and neck, esophageal patients a lot of times, and also our lung cancer patients. We want to, again, just make sure to choose easy to chew and swallow foods. So it says scrambled eggs here. I don't 100% agree with that. But milkshakes, custards, cooked cereals, mashed potatoes, all those types of things. And really working with a speech therapist is a good idea for anybody with head and neck cancer, particularly if it's a little bit more advanced, because you want to make sure that you're eating a consistency that's safe for you, as well as swallowing a liquid consistency that's safe for you. Choosing cold or room temperature foods is a little bit better to tolerate than your warmer foods. Any moisture, capitalize on your sauces, gravies, the same types of tips that I was mentioning with dry mouth. And then you always, regardless of what's going on, want to provide good oral care throughout the day. So taste changes, this one is one that I see during treatment, and sometimes it lingers after treatment too, just to be mindful of that. Some people will have their taste resolve back to baseline after a week or two, and then others takes a few months. So just be mindful of that. But choosing foods that are tart, lemon wedges, lemonade, citrus vinegar, those types of things are good to try. Marinating foods, using a lot of seasonings, sugar-free lemon drops, adding lemon juice or other flavorings to water. And then here's a list of good seasonings for your meats in particular. And I find for the most part, patients tend to like sweet foods. Those tend to taste mostly more like they should, than your salty foods. And so just, trying things like frozen fruits, like it says here, whole grapes, um, you know, orange slices, cantaloupe, watermelon. And then here's that oral care tip on the baking soda salt mouth rinse as well. For a metallic taste, not using metallic spoons and forks, silverware. You want to really try to use either plastic or bamboo plasticware, glass cups and plates. Try not to cook with canned foods because they're going to take on that metallic taste. And then one other tip that's not on here is the same product that makes lubricity makes something called Medikil, and that's metal without the L, QIL. And that's also sold at Walmart. You can order it off of Amazon. And I'm going to be honest with you, I'd say that's about a 50-50 helpful tip. I'll have some patients that say, Blair, my metallic taste is completely gone. Medikil made it go away. And then others say it did not help at all. So I'm not going to steer you wrong. I'm going to be completely honest about that. Okay, so for those of you who have started oxaliplatin or are going to be starting oxaliplatin, that's going to be the chemotherapy that can cause some cold sensitivity. So some tips here: covering up your skin, your nose, your mouth. If it's cold outside, you want to cover your head. Just try to stay as warm as possible. Setting your air conditioning at a moderate temperature, so not so low that it's going to affect you negatively. Making sure that foods are at least room temperature. Make sure to factor in food safety there too. You don't want to leave your yogurt sitting out for hours or anything like that. But sometimes really cold beverages and foods can be offensive. Stay out of the freezer. And don't touch or use ice packs or ice cubes. So if somebody's packing your snack bag for treatment just with ice packs, just make sure that it's somebody else doing it and not you. And so you're not going to be touching the cold. And then just using any gloves. If you're the one that has to handle any cold or frozen food, making sure to use gloves when doing so. So now we're going to switch gears a little bit to food safety. So this is going to be particularly important for our bone marrow patients, but actually for all of us, it's important because a lot of cancer patients, regardless of what type of cancer or treatment, are going to have some low white blood cell count, and we just want to make sure that we are as safe as possible in food preparation. So the very basics of all of this, if a food is supposed to be hot, we want to keep it hot. So that's over 140 degrees Fahrenheit. If a food is supposed to be cold, we want it below 40 degrees Fahrenheit. So if that means if you're preparing something on the stove or the microwave, just make sure that you're getting it out right away and eating it. Or if something's coming out of the refrigerator or freezer, that you're eating it right away as well. Except for oxaliplatin, that's a little bit different. And I'm sure that all of you are already practicing this at home, but just avoiding cross contamination of food. So, not preparing raw meat where you prepare your fresh vegetables. And I would really recommend labeling your leftovers because we want to throw away any type of prepared food after 3 days or 72 hours. So you can either put the date of preparation, the date and the time that you throw it in the refrigerator, and you could, just add in your head 3 days from then to as a reminder to throw it out, or you can document the date and time that it needs to be thrown out, and just to be mindful of that. If you see any tiny bit of mold on your berries, cottage cheese, bread, regular cheese, anything like that, the whole thing goes in the trash. Because the thing is, your mold is going to be microscopic. And just because you can see it on one piece of cheese doesn't mean that it's not all over that cheese. So just make sure that you throw it away immediately. Washing your hands, all utensils, food prep surfaces, both before and after preparing foods is important. Thawing meats in the refrigerator or defrosting them in the microwave is something you're going to want to do. And I confess that I grew up in a house in the South where my family would throw a big thing of chicken in the sink to thaw all day, or ground beef, whatever it was, just because it was convenient. But you absolutely don't want to do that. And I'm sure none of you do that. Maybe that was just my family, but particularly in the context of cancer and treatment. All dairy products, and actually everything, it just says all dairy here, but everything that you put in your body needs to be pasteurized, okay? No raw nuts, and anything that you cook at this point needs to be very well done. So, that's no medium rare burgers or steaks right now. You just want to make sure no like over easy eggs. You want to make sure your eggs are well cooked, just to make sure that everything is killed that's not supposed to be there. And then avoiding cheese that are, made from molds. Your blue cheese, feta, brie, gorgonzola, is something that you're going to want to do during treatment. Fruits and veggies. All fresh produce, whether it's organic, natural, carry dangerous bacteria. And so we want to make sure that we're washing all fruits and vegetables very well. So as soon as you come home from the grocery store, just making sure to, wash and throw those fruits and vegetables in the refrigerator. We always want to be in control of our food, so don't purchase any produce that has already been cut at the grocery store. And so I know that sometimes when I go to Publix, I'll grab that fruit salad with the pineapple and strawberries and cantaloupe honeydew. We don't actually know how clean their knives are, or what kind of surfaces that fruit was cut on. And so even like the cantaloupe that's already been cut in half, you're going to want to avoid, and just make sure to purchase whole fruits that you can wash yourself at home. Don't eat any type of vegetable sprout, as it says here, except cooked mung bean sprouts are acceptable, but no other sprouts. And then again, throwing away fruits and vegetables that are slimy or show mold. So washing produce, just all you have to do is rinse produce thoroughly under clean water. You don't have to use any weird solutions. And in fact, I encourage you not to. We've had patients use detergents, soaps, chlorine, things like that. But if you think about it, that produce is going to absorb the cleaning agents, and that's going to add insult to injury and make you very sick. So we don't want you to do that. Um, Using a clean vegetable scrubber to scrub produce that has a thick surface. So that's going to be your melons, your potatoes, those types of things. And of course, you're going to want to make sure that all visible dirt on the surface is gone. And I'll have a lot of patients say, "Oh, I heard that I can't have salad," and that's not the case. I will say I wouldn't have salad at a restaurant because again, we want to be in control of our food. So just make sure to rinse if you buy a head of lettuce or spinach, just rinsing those leaves one at a time and making sure that all visible dirt is removed. Even if you buy salad in a bag or any type of greens in a bag, rinse it anyway. And it's even if it says pre-wash, pre-rinse, you still want to rinse it one more time. I would recommend if you don't have a salad spinner, that helps to remove the water after you wash it because nobody wants a soggy salad. So that's something you can do, or if you just want to continue to use a colander, that's fine too. And then always checking for use by dates and not, the rule of milk that a lot of people use. Oh, well, milk's good for a week after the date. No, it's not. Um, be very mindful of the use by dates, and then as soon as we've reached that date, whatever it is needs to go in the trash. So dining out, dining early or in off hours is good to avoid crowds. So an early lunch or early dinner, whatever the case may be, asking that your food be prepared fresh is a good thing to do. Even if you go to McDonald's or Burger King or wherever it is you're going, just making sure that food is prepared fresh and they're not just grabbing it from where it's been on the heater. Um, if you're gonna use ketchup, mustard, mayonnaise, don't use the big bulk condiment containers because we don't know who's touching it. We don't know which parts they're touching with their hands. So just getting the small packs, the individual use packs, is a much better thing to do. Or you can just wait till you get home if you're getting takeout and use your ketchup at home. Again, I mentioned this earlier, but if you're going to have fruits and vegetables when eating out, just make sure they're well cooked. That's not, we're not going to want to have tomatoes or salad or anything like that. And since COVID has kind of died down, sushi buffets and regular buffets and salad bars and all that has kind of ramped back up. But I would recommend not doing any of that because again, you don't want to be touching things that other people are touching. And then making sure your utensils are wrapped in a napkin and not set directly on the table. I would go one step further and say, get plastic utensils that are wrapped in plastic. And then don't allow a waiter or a server to take your food back to box it for you. Just say, hey, can you bring me a box, and make sure that you box it yourself if you're taking it for leftovers, and reheat it really well. So these are some recipe resources here. There's several books. I'd say the most popular ones that we recommend are Eating Well Through Cancer is a big one. Also, the fourth bullet point there, the Cancer Fighting Kitchen, is really good. It's pretty easy to prepare meals that are tasty too. What to eat during cancer treatment, that's another good one too. And then here's some good websites for you. There's Cook for Your Life, Memorial Sloan Kettering, the AICR or American Institute of Cancer Research, and then the Cancer Support Community. We as dietitians have added a bunch of recipes there too. My favorite website here, other than the Cancer Support Community, of course, is Cook for Your Life, Healthy Cooking for Patients, and I think I have a slide. This is really great because it has recipes and meal type, and it takes into account whatever side effect you're experiencing. So you may want a recipe if you have taste changes that's very different than if you're just having difficulty swallowing, but it has recipes based on what you're experiencing. And so that's been very, very helpful for patients. And again, that website is cookforyourlife.org/recipes. So just some final thoughts or to wrap it up. Side effects that lead to trouble eating are very common. And again, not everybody experiences side effects, and there are varying degrees in which patients experience side effects. But you're definitely not alone, and we can help you. And our goal is for you to maintain your body weight or have very, very mild loss throughout treatment and to maintain that good, healthy muscle mass in efforts to prevent delays or breaks in treatment and to prevent hospital stays and reduce the amount of time that you're in the hospital. Working with the dietitian for individual recommendations, that's going to be what works best for you. And again, if you are planning on receiving treatment within the Northside Hospital Cancer Institute or are currently, you have access to a dietitian who can take everything your likes. Some people like to cook, some people don't. Your tastes, what you like to eat, your side effects you're experiencing, your past medical history, and they can help create a plan for you. So if any of you are interested in working with myself or one of our dietitians, my email address is here on this slide, and that's blair.avendano@northside.com. Or you can reach out to our secretary scheduler team, and that is outpatient.nutrition@northside.com. And they will likely pass your email over to me, and I'll make sure that you get connected with the right dietitian based on the clinic that you are attending.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.